There we go. So many buttons to keep track of in this. All right, so here's our agenda for the day. We're going to start by talking a little bit about the Washington Poison Center, who we are, what we do. We're then going to go through some different causes of mismanagement, specifically medication mismanagement. We'll go through a few different examples. We'll then spend some time looking through some WACs and kind of some resources to help you address those WACs, and then we'll round it off with some signs and symptoms of medication errors. All right, so diving right into the Poison Center. So we have been in existence in some form or another in the state of Washington for over 60 years, which is really cool to me. So we do a whole lot of stuff. We have our national public, poison helpline. And I'll go through that number in the next slide or so. We also offer a lot of professional education, such as clinical education, as well as public health education, which is what we're doing right now. Now, I will say we define poison rather broadly. For us, a poison is anything, any product or substance that's even potentially harmful if it's used in the wrong way, by the wrong person, or in the wrong amount. Now, that includes a whole lot of different substances. That can be household products, plants, cleaners, bites or stings from critters, as well as substances and medications. So this number right here, this is the National Toll-Free Poison Center Helpline. If you have not done so, I highly encourage you to go ahead and just put this in your phone right now. If you don't do it in time for this slide, we have it on almost every other slide. Just look to the logo in the bottom right corner there. Now, we are literally always open. You can call us at 2 a.m. or 2 p.m. and someone's going to answer. We are always free, so you never have to worry about billing or insurance or anything like that. We're confidential too, so the same laws that protect your privacy in a hospital or a doctor's office, those HIPAA protections apply to us as well. And then we also offer interpretation services for anyone who prefers a language other than English. So if you ever do call the Poison Center, one of our spies, that's specialists in poison information, will answer. This is a group of nurses, of pharmacists, and poison information providers, and they know their stuff. Our spies right now average over 13 years of experience in the call center. When you combine all of their experience together, we get a total of 270 years worth of experience, which is so cool to me. Now, if there's ever a case that they'd like some additional oversight on, what they'll do is they'll reach out to one of our on-call board-certified medical toxicologists. Now, there are 7 of these toxicologists in the state of Washington, all of whom are connected to the Washington Poison Center. Just a little look at some 2019 data. We had over 125,000 calls, which covered over 66,000 cases. And what that tells you is we'll do a bit of follow-up whenever we can. So we'll try to call back, make sure folks are doing okay. Now, we get calls from a lot of places. Most of our calls come from folks just in the home or in the workplace. But we also actually get a lot of calls from EMTs, from first responders who are on site intervening in a potential toxicology case. And we also get calls from folks in health departments, in emergency departments, specifically for those more complex cases. They will often call the Poison Center for a consultation. Now, close to half of our calls or our cases are actually for little kids, specifically kids younger than the age of 6. And most of these calls are for ingestions, which is, as anyone who has interacted with kids will tell you, kids like to explore by putting things in their mouths. Very stressful for those responsible for their well-being. But we are not just for kids. We get plenty of calls about teens, adults, and older adults. And generally, these calls tend to be a bit more serious and more complicated. Now, looking at the first half of this year, 2020, we have a few different reasons, exposure reasons, for older adults. And whenever I say older adult, I'm referring to an adult ages 60 or older. Now, by and large, the most common reason for an older adult to call or someone to call for an older adult is a medication error. And that accounts for close to 1/3 of all of our medication error cases, followed by accidents, and then we get a couple lower categories here for intentional exposures and adverse drug reactions. All right, so today we're talking mainly about medication errors and how to prevent them. Now, a medication error can happen with any of these 5 wrongs. It can occur in the wrong dose, if it's the wrong medication itself, if it's given to the wrong person, or taken at the wrong time, or it's taken in the wrong way. So we're going to go ahead and launch a poll real fast. We have a few of these throughout the training today, and we kind of want to see. Well, let me go ahead and launch it first before I jump ahead of myself. Right, what are the most common med errors for older adults? Go ahead and leave this up for a few seconds to give folks a chance to answer. Give it just a few more seconds. We got about 30% of folks who voted so far. All right, I'll go ahead and close it out for now. And we'll share this just to see what we've done. All right, so a lot of folks say wrong dose or wrong medicine or wrong time. Now let's see what the answers are. Most common are wrong dose, wrong medicine, and wrong person. So pretty close, folks. All right. So what are some consequences of mismanagement? Well, there's a huge range. For some folks, they may be totally fine. They may be very, very minor issues that come up. But for others, it may be very serious consequences. For some folks, they may experience decreased effectiveness for their medication. They may have an adverse drug event. They may, in fact, be hospitalized. And sometimes medication mismanagement can lead to death. Now, there are also economic consequences that folks don't often talk about. We obviously want folks' health to be protected, but we also don't want folks to have to spend money whenever they don't have to. Hospital visits are so expensive, and that can really, really add up over time. So how do we do this right? Well, we take all those wrongs and we flip them into rights. And we're going to spend the next, well, not 90 minutes now, next 75 minutes or so, kind of talking about how to do that. But first, we're going to start by some causes. We're going to go over causes of older adult medication mismanagement. All right, so there are tons of these. So this is kind of a bigger section, but we're gonna go through one slide at a time. So first off, something that can go wrong may not have anything to do with the older adult's actions themselves. It may have to do with a caregiver error. And now, typically, these fall under 2 main buckets. We have folks who might incorrectly fill medication organizers, so they may put the wrong medication in or the wrong dose of the correct medication. We also have this other bucket. Folks may administer the medications incorrectly. And again, it can be any of those 5 wrongs. Now, there may also be some physical limitations. So physical limitations are a very common source of mismanagement. And as folks age, as they get older, vision may worsen. And this can make it more difficult to read labels and other important materials that go with the medication. Older adults may also lose grip strength over time. This can make it more difficult to open medication bottles or packages. And if they have a hard time opening these containers, they may end up using different storage mechanisms outside of the original packaging. And some of these may actually put folks at greater risk. For example, someone may just dump all their medications out for the week into just an open bowl. And that can be pretty risky. They may grab the wrong one, or someone else, little kid maybe, might think, oh, look, candy, and grab a handful. Now, some older adults may also experience hearing loss, and this can affect their ability, potentially affect their ability to understand what a doctor or a pharmacist verbally explains to them about a medication, as well as any instructions that go with that medication. Now, the last limitation we have listed here is difficulty swallowing, and this can make it hard for an older adult to take their pills. This might mean they may alter that pill somehow. They may cut it, crush it, or alter them in some other way, and that can alter how the medication itself is absorbed. All right, a little bit on cognitive decline and dementia. So more than 10% of older adults, this is between the ages of 60 and 64, experience some level of cognitive decline, which is associated with age. And this percentage typically increases with age as well. So cognitive decline and dementia can lead to forgetfulness when taking meds, as well as confusion over medications and care plans. The older adult may not understand which medications to take and how to appropriately take them. So cognitive decline and dementia, it can also result in accidents with non-pharmaceutical substances, such as mistaking a non-edible item as food or as a medication or a therapeutic product. Now, folks who have attended any of our webinars before, you'll know that the Poison Center, we love talking about lookalikes because we get so many calls about this. Someone grabbing any of these thinking it's something else. So you can grab a cleaner thinking it's a beverage, or grab nose spray thinking it's an eye drop. One of the scary ones we get calls on is someone grabbing what they think is an eye drop and it's really super glue. No fun for anyone involved. So complex medical regimens can also make older adults more likely to mismanage their medications. A complex medical regimen is when an older adult takes multiple meds overlapping and multiple doses per day, and or sees multiple providers who prescribe medications. So because older adults tend to take more and more medications over time, this adds that more and more complexity. So approximately 90% of older adults take at least one med, and around 50% take at least 5 medications. Now, the more meds someone takes, the harder it is for them to know and understand what their whole medication repertoire is, when to take them, and how to take each of them. The more doses of a medication is required in a day, the less likely the individual will take their medications correctly or at the right time. Now, when there are multiple healthcare providers prescribing medications, the providers and the older adult can find it difficult to understand what the older adult's care plan is. This increases risk for medication errors, miscommunication, and lack of care continuity between healthcare providers can actually result in meds that are doubled up, that are unnecessary, or even interact with other medications. This can also create overly complex medication plans for the older adult to interpret. Now, medication management, proper medication management, does take some specialized skills and knowledge outside of everything we've just talked about. Folks also have to know how to navigate insurance. They have to know how to even access their providers. They have to be able to interpret their instructions and the materials, and they often have to run through a few different calculations. They may have to figure out how many pills equal a set dose. They may have to figure out how many they can take in a 24-hour day. So there are just layers and layers and layers of complexity to this. Now, another common cause for medication errors are leftover medication. Now, having leftover medications, these are meds that are expired, unwanted, or unneeded. This can also be, this can cause some concern. By keeping these medications, someone risks taking the wrong med. Cost, again, cost can be a source of concern as well. Someone who may not be able to pay for their prescriptions, they may not take the right dose. They may not take the right amount of the medication. Say they need to refill it, but they can't afford it, well, they're not going to be able to refill that. Now, a little bit on substance use as another cause for medication errors. Substance use can alter medications in a few ways. So it can affect how substances are. Oh, excuse me. Let me back up for a second. As someone gets older, their body may not be able to break down substances the same way that it could have when they were younger. And as someone gets older, as we've already said, they're more likely to take more and more medications. Now, this opens up more opportunities for potential interactions with various substances. Now, that's just the interaction side. Intoxication itself can also affect one's ability to properly manage medication. So we're going to first start talking about alcohol. So by itself, with nothing else involved, alcohol can lead to problems with concentration, problems with memory. It can cause drowsiness. Now, when we start seeing alcohol interact with other medications, again, it can increase that drowsiness. It can lead to dizziness. Again, problems with concentration and memory. Now, there's also a concern with double dosing with alcohol. Now, some medications actually contain a bit of alcohol, so if you already have alcohol in your system, it may bring on far more than you bargained for. And it can actually make some medications less effective, or it can go the other direction. It can make them too powerful. It can make them harmful to the body. So a lot of things can kind of go wrong when a medication interacts with alcohol. We're going to talk a little bit about opiates and opioids. There's a lot going on in this slide, and I'm not going to go through the whole thing. We're just keeping this here in case anyone wants this chart as a resource. A big takeaway is that opiates are a class of drugs that are derived from opium or from the poppy plant. They're a bit more naturally produced. Opioids, on the other hand, are at least somewhat synthetic. Now, a good general rule when it comes to opiates and opioids is that the more synthetic something is, the stronger and more powerful, more longer lasting it is. Now, all of these operate on the same parts of the brain. They activate the same receptors. But what can be concerning with the semi-synthetics or the synthetics is that something like Narcan or naloxone, for folks who haven't heard of that, Narcan or naloxone is a way to reverse an opioid overdose. But if something is too powerful, then someone may have to administer multiple doses of Narcan in order to reverse that overdose. So some adverse reactions attached to opiates and opioids. They can definitely cause confusion or delirium. They can make folks really sleepy. It might impair vision, which makes it hard to read a label. And again, like we were seeing with alcohol, we can see some problems with attention and memory, which we definitely want those things working right for someone to maintain good medication management. Switching gears a little bit just to talk a bit about cannabis or marijuana. First off, I will say cannabis and marijuana are not two different things. They're just different terms referring to the same plant and the same substance. Now, having said that, there is just a smorgasbord of cannabis products out there right now. We have dried flower and bud. We have these different concentrates. Some are oils, some are waxes. We have this huge sort of other category of edibles, drinkables, tinctures, and other medications. Now, a few things to keep in mind with all this is having such a broad spectrum of products means that they're all different. They all may act on similar parts of the body, but they have different components, different types of composition, so they can affect different people differently. Now, when we're looking at medication management, THC, which is the main, what we call psychoactive or intoxicating component of cannabis, THC on its own can impair cognition, attention, and short-term memory. It can also alter our ability to properly estimate time. This is kind of an odd one, but a lot of cannabis users report that when they're high, when they're intoxicated on cannabis, it feels like hours and hours have gone by when really only half an hour or maybe an hour has passed. And we definitely want proper time estimation, time management in order to manage medications properly. Now, this can impact medication in a few ways. Again, around managing time, around memory about taking medications. Folks may miss a dose or they may take too much. And again, comprehending medication instructions may be impaired if these other areas are also impaired. A little bit on drug interactions with cannabis. So there is a concern with the liver. So THC, again, that's one of those main components in cannabis, as well as CBD. This is another common component in cannabis. These are metabolized in the liver. Now, the liver is where your body breaks down all sorts of things. A lot of other drugs are metabolized in the same exact system. So if we have too many trying to be broken down all at once, it can build some up in the body more. And this can lead to stronger or longer lasting effects. We have noted some potential interactions with cannabis in certain medications. It can increase the amount of drowsiness one experiences. It can increase their risk of bleeding. And we really need more research in order to better predict this, but there have been some studies that indicate that it could interact with other meds affecting blood sugar and affecting blood pressure. Now, these are so difficult to predict, and we absolutely recommend folks calling the Poison Center, talking to a doctor, talking to a pharmacist. Ask any and all questions you have before combining any substances. All right, let's see. Almost done with this section, and I'll lay eyes on the comment section and see if there are any questions we can address. So a little bit on COVID-19. One of the big concerns right now is there are so many rumors, so many sources of misinformation about what may or may not be helpful for COVID right now. And it's very concerning for us at the Poison Center. We have reports of more and more folks self-medicating with increased substance use, with the substances we just talked about, as well as seeking out and trying new substances that quote unquote prevent COVID-19. And I want to clear the air. There is no substance that can prevent or treat COVID-19 at this time. And we also have inappropriate use of non-pharmaceutical substances happening right now. So I'm going to go ahead and launch another poll for y'all, and we'll see what you think. All right, so go ahead and launch this. We would like to know what you think is the #1 substance misused by older adults in 2020. I'll give it just a couple more seconds. All right, I'm going to go ahead and close that, and I'll share it out. Looks like most folks actually thought alcohol. The correct answer, though, is bleach. We have had more calls on bleach exposures during 2020. And a lot of this has to do with not following proper instructions for bleach use. It may be mixing, folks may be mixing it with another cleaner. They may be doing things like cleaning their masks with it, which we advise folks to use soap and water for cleaning masks, that kind of thing. All right, thanks so much for answering that, folks. It looks like we do have a question. I'm going to have to pass this one on to Karen, so I'll read it aloud so everyone can benefit from the answer. Are adult family homes allowed to dispense cannabis with a doctor's prescription, and is it allowed by a nurse delegator now? Karen, can you take a stab at that?
Yeah, sure. Thanks for the question. So physicians don't write orders for cannabis. You can get a medical card for cannabis, but they're not actually writing a prescription for cannabis per se. With that said, each adult family home has the opportunity to put a cannabis policy into place, and you can determine what form of cannabis can be used in your home if you allow it in the home at all. It should be locked away with all the other medications. And it also, so of course, stored appropriately. And it would be a good idea to let the physician know that a resident is taking cannabis and what form they're taking it. And if it's recreational or the medicinal ones, of course, you would get a medical card for.
Perfect. Thank you so much for that, Karen. And I will say, just if anyone is curious, Megan and I also do have other trainings all about cannabis. We have some on cannabis with a focus on older adults, and then others on just cannabis more generally. So if folks are interested in any of that information and attending one of those trainings, please reach out to us. We'd be happy to put one on for you. All right, so we're now going to shift gears and talk about some examples of medication mismanagement. So once again, here are those 5 wrongs. These are the 5 things that can go wrong to lead to medication mismanagement. Now, what we're going to do is I'm going to ask a series of questions and ask folks to reply through the chat box. We'll do a poll a little bit into it, but chat box for now. So, what do you all see in this kind of medicine cabinet? What kind of things do you see right now? Go ahead and throw out your answers in the chat box, if you will. You can send it to everyone or just the organizers. All right, I see disorganization as one. Disorder. All right, we're getting a theme here. Clutter. Yep. Absolutely. There's a lot there. Yep. there is a lot there. Can't see everything. That's a good one. So can't see all the stuff in there. Disorder and confusion. Y'all are picking up on the themes really well. All right. So we went ahead and listed. Oh, an accident. That is an excellent answer. I see an accident. Wonderful, folks. All right, so what we listed were medications are unorganized. They're intermixed with other family members, so there could be multiple folks who are all storing their medications in the same spot. And someone else just chimed in. Who goes to whom? Very good. You guys are very, very engaging today. I love it. There could also be leftover medication here. All right, let's see. So go ahead, and if you would, list what these could lead to. So having unorganized medications, what could all this kind of stuff lead to? Citations, all right. There's one. What I should have said was what kind of medication wrong? What kind of medication error? There we go. Wrong person. There you go. Wrong med to wrong person. Taking the wrong medication. Awesome. You guys are awesome. All right, so we got wrong medication for this top one here. We've got medications intermixed with other family members that could lead to the wrong person. Having leftover meds could lead to any of these three wrongs: wrong med, wrong dose, or wrong person. All right, so what can happen if an older adult is unsure of a medication's purpose? So which of the wrongs could occur? I'm seeing wrong way, wrong medication, wrong reasons, wrong dose, wrong time. You guys are hitting all the right points. We got all the wrongs here. So having uncertainty over a medication's purpose could lead to any of those wrongs. All righty, so I believe, yes, this one is a poll. So I'll go ahead and poll this. Bear with me, folks. I just got to navigate to get to the right one. All right, so what happens if an older adult, or what could happen, I should say, an older adult does not use a medication reminder system? Give it just a few more seconds. All right, I'll go ahead and close it and share the results. Most folks listed a wrong time, a few wrong medication, a few wrong dose. So let's see what we've got. We got wrong dose and wrong time. All right, so I think that is the end of my portion here. We're going to go ahead and switch gears and have Megan take the reins, and I will lay eyes on the chat box to make sure no questions got lost in the bombardment of answers. I love the engagement, folks. Thank you so much.
All righty, everyone. I'm going to switch over to my slides really quick, so bear with me. All righty, here we go. Okay, so we're going to dive now into all of the different WACs that adult family homes need to comply with. So this, I'm just going to warn you ahead of time, this is a meaty part of this presentation and it is dense. We are going to cover a lot of information. So please, if you have questions, put them in the chat box. If I'm not sure of the answer, we do have Karen, so hopefully she can, between the three of us, we can provide answers to any questions that you have. So Alex has done a great job of setting up medication mismanagement. What are some causes that can lead to it, and some primary examples of what mismanagement can look like. So thankfully, in an adult family home setting, you all have to comply with a bunch of different management strategies that really decreases the risk of an older adult experiencing mismanagement. So we're going to dive into the WACs now, and then I'm going to go through some specific resources and tips for how you can meet these WACs. First, just making sure we're all on the same page. What is a WAC? So that stands for Washington Administrative Code, and they are sources of primary law in Washington state. So WACs are issued by executive branch agencies. For adult family homes specifically, WACs are going to fall under the Department of Social and Health Services. So you all have a ton of different codes you need to follow, but there are 14 that are specific to resident medications. We'll go through all of those 14, but the overarching concept of them is that adult family homes need to have services that adequately meet medication needs and meet all of the laws and rules. So I am just going to provide highlights and summaries today as we go through these WACs. So please just refer to the full WACs for accuracy in all of those necessary details. You'll see that I listed the WAC numbers up at the top of each slide when we're talking about a specific one. Okay, so this very first WAC that we are going to cover is essentially a summary of what adult family homes need to do. So the WACs that follow are going to go into greater detail with each of these points. So first, if an adult family home admits residents who need medication assistance or medication administration services, that home has to have systems in place that do an assessment, a negotiated care plan, and then provide all of these different tools that make sure that medications are being taken correctly and safely. We're going to start by talking about these two specifically, the assessment and the negotiated care plan, with assessment first. So each resident that enters an adult family home needs to be assessed for the amount of medication assistance that they need. So once that assessment has taken place, the adult family home needs to let that resident's practitioner know if the resident's ability to take their meds is affected by any sort of physical or mental limitations or their environment. And then if there are any changes throughout that resident's time at the adult family home, any changes that affect their need for medication assistance, that also will need to be communicated with a practitioner who will decide if a reassessment is necessary for them. So what topics does this assessment need to include? There are lots because it does not just cover medications. So this is not a complete list. Be sure to reference that WAC for the whole list of topics. But for things that are specifically related to medications, the adult family homes needs to gather information in their assessment on the resident's recent medical history, all of their current prescribed medications and any contradicted medications, medical diagnoses that the resident has, and then the medication management status of that resident. So their ability to be independent or the amount of assistance that they're required and, what are the specifics that they need assistance with. So the amount of assistance needed by a resident when taking their meds falls into these three big buckets. So there are residents who can independently self-administer their medications, so they don't need help taking meds. They're able to directly take them by eating, drinking, inhaling, shot, whatever way that medication is supposed to be administered. They can do it themselves. The second bucket is folks who need a bit of assistance from a non-practitioner in taking their medication, but they can still ultimately administer it themselves. And then there are residents who need full-on medication administration in this third bucket. And so that person needs to have their medications completely administered by someone who is legally authorized to do so. So a physician, a nurse, a pharmacist, or a nurse delegate. So when we're thinking about this WAC, about assessment, it is so broad. There are so many different topics and components to consider with the older adult, just related to medication, not even including all of the other things you need to assess for. So at the Poison Center, we have a tool that we provide to caregivers that helps them determine an older adult's ability to manage their medications. So if you look in your materials tab on your attendee control panel, I've uploaded these materials that we're going to go through now in the hopes that you might be able to use some of the ideas within it to take a deeper dive into a resident's ability to manage their medications. It's not going to be a perfect fit for the adult family home setting, but I'm hoping it'll at least provide a starting point or a guide for different things that need to be looked at. There are definitely some limitations with this for you all, though, that I just want to make sure are acknowledged up front. So our assessment guide, it's really based on interacting directly with the older adult at a single point in time. So what they say or what they do at that time might be different than how they typically manage their medications, or they might just have a really big range in their ability to do so. So that's an important thing to acknowledge and to know when assessing that things can change by day or even by hour. But hopefully this assessment guide is still useful for you all and just providing some areas to look for. Okay, so the goal of our assessment guide is to determine an older adult's medication management status, what their current practices are, and their current understanding of their medications. So our guide divides med management into 3 categories: safe medication storage, medication knowledge, and medication management strategies. Each category within the guide uses 2 assessment techniques. There are open-ended and closed-ended conversational questions. These are shown in quotation marks, and these are questions that you are actually going to ask the older adult. And then there are direct observations of the older adult's environment and practices. So prompts for those observational questions are shown in brackets. When you go through these conversational and observational questions, you're going to assess the older adult's responses and their practices based on a stoplight format. So there's green lights, meaning the older adult is already following best practices for medication management. Nothing needs to change. They don't need help with it. A yellow light means they might be using some concerning practices that might lead to medication errors. And then there are red lights, which really mean, whoa, the older adult's current practices, they're placing them at high risk of medication error. So our assessment guide, it doesn't perfectly align with the adult family home medication administration levels. So those 3 buckets we just looked at. But I think it can give you some general guidelines on where an individual falls with needing assistance. So for example, someone who has all green lights in the assessment, they really might likely be a candidate for just independent self-administration. But if there are some yellow lights that are sprinkled throughout, maybe self-administration with assistance would be better. And for individuals with lots of red lights that would not be resolved by just assistance with administration, maybe they're a better fit for full-on medication administration. So we'll quickly run through what you will assess with our assessment guide. So remember I stated earlier that the guide separates med management into 3 categories, the first of which is safe medication storage. So within this category, you're going to be looking to see if medications are stored in a single organized location. Are they in their original containers or in a medication organizer? Do they keep their medications separate from those of other household members and pets? Are they storing them separate from non-pharmaceutical lookalikes? And are they out of sight and out of reach if there are any kids that might be having access to that person's room? And then finally, you'll also look to see if all medications are current. Do they have any leftover meds, any expired, unneeded, or unwanted medications? I'm moving through these really quickly, so just let me know if you have any questions in the chat box. We'll move on to this next category, which is medication knowledge. And our assessment guide will walk you through how to assess if an older adult knows for each medication that they take, why they take it, and how it helps, how often they're supposed to take it, and what time of day, any special instructions that go along with it, like if there are specific foods to avoid, or even if a medication should be taken with or without food, or with or without water, stuff like that. You'll assess if the older adult knows the correct route of administration and what the prescribed amount or dose is. All right, so now we're on to the third category, and I'm going to ask you all to pop into the chat box. We've covered a lot of medication management strategies already with the med knowledge and safe storage piece, but what do you think are some strategies that you could look for? What could you assess if an older adult uses a particular thing or employs a particular strategy? You can pop that in the chat box. While you're doing that, I will see if there are any questions. Their reaction before or after they finish, if they're following the appropriate instructions for the medication. Things like using applesauce if they don't like swallowing them with water. Yeah, so there are things like that you could assess for. You can also look to see, do they already have a current and accurate medication list? I know you all will already need one regardless for an adult family home, but it could be good to still see, are they already using something like that? Do they have a reminder system to take their medications? This is especially important if they think they're going to be independent in self-administering their meds. Do they use one pharmacy? And do they have a reminder system for refills? We have a couple other things here. Based assessment, care plan, knowing if a med needs to be crushed, and do you have a doctor's note? Yep, all of those. So there was one question earlier that we missed during Alex's section. I think we're going to have to ask Karen about this again because I do not cover PRN medications in this presentation. But the question is, adult family home setting, why does a resident have to have a script if the resident has a headache and knows that Tylenol will help?
Sure. So for any PRN medication, the doctor does have to sign off on it and have it listed on the MAR, so just to have a record of it. If the resident isn't taking it on a regular basis, if it's been a PRN in the past, you can always review those with the current physician and see if the PRN can be removed, just so you don't have to continue to make sure you have that in stock, that it's not expired medication. But it is just part of the WAC that says that any medication, even a PRN, is listed on the MAR and has a current physician's order for it.
Perfect. Thank you, Karen. All right, so we're going to move on to the negotiated care plan now. So once you have done the assessment of the resident, you need to put together a care plan for that's specific to them. So this plan has to identify the amount of medication assistance they need, as well as why they need that assistance. And then it needs to detail how they will receive their medications or take their medications when they're away from home, or if whoever assists with their medications is not available. So we're going to go through the different levels of assistance and points that you might identify in the negotiated care plan. So for folks that independently self-administer their meds, the adult family home needs to make sure that they can indeed administer their medication safely and correctly. That's the first point. And then just second, these residents are allowed to keep their medications in their room, provided that they are securely locked or they're in some other agreed upon area, and that will be identified in the negotiated care plan you create with them. To self-administer with assistance, the adult family home needs to make sure that the resident can take the medication themselves. So they can put it in their mouth, they can apply it, inject it, but you can help them do so safely and correctly. So like you can provide setup assistance just before the resident takes the medication. One thing to note here is that the resident needs to know that they are taking a medication. They don't need to be able to name what the medication is or what its effects are or its side effects, but they do need to know that they are taking a medication. So another area that adult family homes can help with is the actual administration of the medication. So as long as the resident does it themselves still, administers it themselves still, the adult family home can help with steadying or guiding their hand. They can transfer medications from one container to another to make it into a single dose. You can remind or coach the resident to take their medications. This does not, though, include any shots or intravenous medications except for pre-filled insulin syringes. So this final level, medication administration, is where everything needs to be done for the resident. So that will be in the negotiated care plan, that you are doing everything for them, and you also need to identify and ensure that the medication is being administered by one of these three individuals, so a practitioner, nurse delegation, a family member, or other legally appointed resident representative. So the negotiated care plan, it requires a lot more detail than what's just included in these WACs. So again, I really want to highlight our assessment guide as a potential resource to help with fleshing out the details of the care plan. You can use some of those practices that were identified in the assessment to specify how the resident manages independently or what they specifically need assistance with. All right, I'll lay eyes on the chat box really quick before we move into this next section. I think we are good. So we're going to move into the WACs now that are associated with administering medications. We have some Poison Center tips as well that go along with all of these. So just laying eyes again on that big summary WAC. We've covered the top two. Now we're going to go on to the next two, which both have to do with administering medications. All right, so there is the log. Adult family homes need to keep an up-to-date daily medication log for every resident, except for those who are assessed as independent and are self-administering. So this log needs to include the name of the resident, the name of all of their prescription and over-the-counter meds, the doses of those medications, frequency taken, and approximate time to take them. And in addition to all of that medication information, the log needs to include initials of the staff members who assisted or gave the medications. If a resident refuses a medication, that needs to be documented with a reason for why they refused. And then any new changes or newly prescribed meds need to be in there as well. So we have another poll here, which is kind of tying back to like Alex's examples of mismanagement that he went through. What do you think can happen if you or whoever is providing care do not maintain an accurate log? And you can select more than one response on this. So select as many as you want. Give folks a few more seconds. All right, Alex, go ahead and close it. You can share those responses. So we're kind of all across the board. We have a lot of folks saying wrong dose, wrong medication, and wrong time. I'll show you what it is. Maybe. There we go. It's all of them. So yeah, if you don't maintain an accurate log, you really risk all of the medication errors because you have to rely on memory. And when you have multiple residents, or if you're distracted, or if care plans are changing, that can be definitely risky to not have an up-to-date, accurate log. It can be easy to make a mistake, any of the mistakes. Okay, so when you're administering medications, you need to check the 5 rights every time for every medication and document immediately. So check the right person, the right medicine, the right dose, the right time, and the right way. We'll go through each of these rights now. So the right person. You need to verify the name on the log, the medication label, and the resident. This kind of seems like a no-brainer, but it's especially important if you have any new caregivers that might be in the home or new residents. So just be sure to check all 3 of those, verify them before giving the resident their medication, and then prepare and administer medications to only one person at a time. That way you know that what you are giving them is indeed their medication and there hasn't been any sort of mix-up when you're distracted or talking to someone. The right medication. So you can help make sure that it is correct by triple checking the medication when you take it from its storage area, when you remove it from its container or bubble package, and when you are documenting. So then you want to match the medication name with the name that's listed on the medication log, or MAR. And also, whoever is administering that medication needs to be able to identify what it is. For the right dose can be very confusing. It can be really easy to mix up on accident because there's a lot of different factors and numbers and things that are involved with it. So simple tips are to always check if there are decimal points and what are the units for something. 0.25 can look a lot like 25 if you are just quickly glancing at it. Check to see, is it milligrams that they're talking about, or is it the number of tablets? And then verify that you are looking at the dose of something or the strength of something, depending on what you need to be interpreting. So, for example, one tablet might have 250 milligram strength, but then the resident is supposed to take 500 milligrams. That's their dose, so they would need to take 2 tablets. Be sure to note if there are any dosing limitations on a medication. There are some that say that no more than X amount of this medication should be taken within 24 hours or within like a certain time period. So be sure to note any of those limitations and document them in the log so that if there is another person that comes on board to administer medications, they are aware of what has happened and if that limitation is being close to being met. So sometimes medications are altered to help the resident take them. So altering can be crushing, cutting, opening, or mixing medications with foods or liquids. So before altering a medication, you need to consult with the practitioner or pharmacist. And if they say it's okay, then you just need to be sure that you record the time, date, and name of the person who has provided that permission or consult. The other thing with altering medications is that residents need to know that the medication has been altered and that it's been put into their food or drink or whatever you have done with it. Some medications should not be altered though. So enteric-coated medications, so these help them from being broken down in the stomach. So if you cut or crush these into smaller pieces, they might actually end up irritating the stomach. So those, if they say enteric-coated, make sure that you never cut or crush them. And then some also should never be chewed. If a medication is okay to be chewed, then it will list it on the label, but otherwise do not allow residents to chew them or alter the medications to do it that way. because that can actually cause the medication to be released in the mouth, which could make it not as effective because it would have improper absorption, and it also just has a really bad taste when you do that. So just bottom line, check with a practitioner or pharmacist and check the label. If you are going to alter any medications, be very careful when doing so, because there's a definite risk of whoever is doing that inhaling and having an inhalation exposure to the medication. So use closed systems if you're going to cut or crush, and then only do so to one pill at a time. With liquid medications, there are some specific tips as well. So only pour these when you are ready to administer the medication, and just set the medicine cup on a level surface and pour small amounts at a time. You never want to pour liquid medication back into the bottle. The correct way to read a liquid medication is to read the dose level at the lowest point of the curve. Alrighty, so right time, and making sure you can get this one is to give medications at the specific times that are ordered by the practitioner. Sometimes though, they're not going to provide the specific time. So the WAC for this actually gives you some approximations for when medications should be given. And then it also just delineates that you need to be sure directions are followed with taking medications before meals, after meals, with or without food, at bedtime, etc. So sometimes mistakes happen when you are giving several medications by different routes at the same scheduled time. So you can avoid having a wrong way error by completing the administration of one route first. So for example, administer eye drops first, put them away, and then wash your hands, and then administer the next medication, ear drops, for example. The last slide in this administration section is about medication refusal. So this WAC just talks about how residents do have the right to refuse to take their medications. So if that happens, or if you become aware that a resident who is self-administering refuses to take their medication, just notify that resident's practitioner. The exception could be if a provider, resident manager, caregiver makes some sort of judgment about the impact of that resident's refusal. Okay, I'll check for questions really quick before we move on to this last WAC section. It's a shorter one. Y'all are troopers for sitting through this. Not seeing any questions, so we will move on. So this category is a little bit of a catch-all. It's our miscellaneous category for those remainder WACs. We do have this last bullet point from the big summary WAC to cover on current medication lists, and then we just have a couple other random ones that are thrown in there. So medication lists are required for all residents, even if that resident independently self-administers. So a good medication list, an accurate medication list, needs to include every over-the-counter medication, vitamin, or supplement that a resident takes, as well as any of their prescription medications and any other substances that they might use. Like we talked about cannabis earlier, that should be included as well. Encourage older adults to take their medication list with them to every healthcare provider appointment, just so that that provider can see all the medications being taken, make sure the list is accurate, look for any potential interactions. So I'm sure you all probably have ways that you, well, I know you all have ways that you put these lists together, but we also have a development guide if a resident doesn't have a medication list yet or needs an updated version. So that is uploaded into the materials section as well. And it's a way to more collaboratively create a medication list. You can sit down with them, and it has a bunch of question prompts to make sure that you're capturing all of those medications. We also have medication list templates that you are welcome to use. Our format of a medication list is a little bit different. We, instead of just having one big list altogether, we use one worksheet per medication. So that way, if things change, the dosage, or if they're no longer supposed to take the medication, or they add a medication, a page can just be removed. That way they don't need to create an entirely new list. So for our templates here, we have separate worksheets for prescription and over-the-counter meds or supplements because there's a little bit different information required for each. There is a WAC that is specific to psychopharmacologic medications, and those are meds that treat mental health conditions. So examples would be antidepressants, antipsychotics, benzodiazepines. So if a resident is taking a psychopharmacologic medication, you need to ensure a few things: that their assessment indicates that this medication was necessary. The medication needs to have been prescribed by a professional with prescriptive authority. And then in addition to specifics about administering that medication, the negotiated care plan that you have with the resident needs to include some environmental or staff behavior strategies that will help address the symptoms for what the resident is taking the medication for. Any changes to these psychopharmacologic meds can only happen when a prescriber decides it's necessary. And then the last point is just that residents need to be aware that they are taking that medication. They need to know that they're taking it and that it might alter their mind, their mood, their behavior. They need to know why they're taking it. And I see a question here about, can we download the MedList template? Need a copy, please? Yes, so it is currently uploaded in your attendee control panel under materials, but I will, after the presentation today, I'll send the slides again and these resources as well as a recording to the presentation. So you will have access to everything. So the adult family home, you all need to ensure that all prescribed and over-the-counter medications are stored in locked storage in their original containers with their original labels, and then appropriately for each medication. So some medications need to be refrigerated. So that med would need to be in a refrigerator and locked storage. We have a few of our own Poison Center tips with safe medication storage as well. So store liquid medications below any dry items or even just in a separate location. This is so that if the medication were to leak, it won't contaminate or alter, any of those other dry, any of those dry items that might be there. Store oral medications separately from other medications or medications that are given through different route, so like topical medications. That way you just make sure you aren't going to have a mix-up of the wrong way. And then store medications separate from any of those lookalike substances, which we always love at Poison Centers. We talk about all the time. Alex, I know, referenced this earlier, but you have no idea how many times we hear about older adults mistaking glue for eye drops or eardrops for eye drops. So it's really important to just keep those things separate. Adult family homes can have medication organizers. There are specific rules about who can fill them. The important point is that residents or anyone assisting with medications needs to be able to readily identify what the medications are in the medication organizer. And those organizer needs to have labels that really clearly show the resident's name, what the medications are, their dosage, and those labels need to be kept up to date if anything changes. All right, this is our last WAC, and it is all about medication disposal. So you all need to have and implement written policies that address disposing of unused or expired resident medications. So these meds need to be disposed of for both current residents and any residents who have left the home. At the Poison Center, we operate the Take Back Your Meds website, which has a map function and a search function of all of the different secure medicine return locations in the state of Washington. So some of these are in pharmacies, some of these are in police or sheriff's department buildings. So you can go to this website, take a look, see what all they accept. Not all disposal sites will accept every kind of medication, so it's important to take a look to make sure what you're taking back is appropriate for that site. So we have one more poll to do specific to this medication disposal topic. We are just curious if you have ever used Take Back Your Meds. Give people another couple seconds. All right, Alex, you can go ahead and close the poll and show it. So most of you haven't used it, about 18% have. So that's always a resource for you, and you can use it personally too. Let's see here. There are a couple comments on this. At our local pharmacy, and a few times when the sheriff's department has done a med take back station. Yeah, and there are DEA medication take back days. Unfortunately, due to COVID, they were canceled this spring, but they usually happen a couple times a year, which is another great way to take back and dispose of medications. But the good news in Washington is that every day is medication take back day here because we have so many resources for secure medicine return. Let me see if there are any other couple here. Another person said, I just send it back to the pharmacy if unopened or destroy if opened, and others use a prescription destroyer. Yeah, there are different ways to do so. Another couple of questions that I think maybe Karen needs to answer instead of me, so I don't give you the wrong information. So this one, I believe, is specific to psychopharmacologic medications, and it's asking, is a consent form needed prior to initiating the psych meds once ordered?
All right, yeah, we get this question a lot. A consent form used to be needed or required. That is no longer needed. Basically, what you need to do is make sure that you document that the resident and or the legal representative is aware that the resident is taking that medication. And so you can just document that in the negotiated care plan and have them specifically initial that section of the negotiated care plan, or if you're talking about any other interventions that are being put in place to help with whatever the psychopharmacologic medication is being used for, then you can have them initial at that point. So there's a couple of ways to do it.
Perfect.
So no
Thanks.
form is good. Yeah, thanks.
Yeah, and there's another one here asking, oops, where did it go? Sorry, I just skipped over it somehow. Is Ensure Nutritional Boost considered a medication?
So we've gotten conflicting answers from residential care services on this one. If it is being used for more of a treatment, then it needs to be added into basically the MAR listed as a medication, more of a treatment. If it is being used because the resident just enjoys it, I would just make sure that you document that you've had a discussion with the physician, just to make sure that that's not going to be contraindicated with any other medications that they might be taking.
Great, thanks. And we've just had a couple more comments on the medication disposal. Other people saying that they use drug busters and log it. Oh, one more question. Do you update this representative initial or signature each time the psych meds are ordered, or is it one-time consent?
If you have it, I would do it annually. You know, whenever you update the negotiated care plan after the assessment is completed, and then just make sure if anything has changed with any of the psychopharmacologic medications, you want to make sure you update it, but you don't have to update it for every refill.
Great. Thank you so much, Karen.
Of course. Yeah.
Yeah, this makes it a lot easier. I do not want to give people wrong information. Okay. We just have a couple short sections to go. So I wanted to just very briefly go over some signs and symptoms to look out for medication errors. This is kind of a tough one to actually cover because it can really vary a lot. Signs and symptoms depend a lot on what the medication or medications are and the medication error as well. And the first thing you really have to figure out when you're seeing signs and symptoms is, what is it even coming from? Is it a medication error? Is it potentially a drug interaction? Or is it just side effects from a medication that the resident is taking? So to help you differentiate this, it's really important for you to become familiar with what the common side effects of a medications are, and then to really observe the resident and document if you see any physical or behavioral changes that are outside of the norm for them. So that can really help you know better what are these symptoms coming from. Okay, so some general signs and symptoms for those medication errors. If meds are skipped or missed, then the signs and symptoms that go along with them might be a lack of medication effect. So worsening or flare-ups of disease symptoms. So for example, a person who has really well-controlled blood pressure, they might suddenly have high blood pressure if their dose for their medication was accidentally skipped for several days. So you would see that their condition gets worse. If extra doses or double doses are taken, on the other hand, the signs and symptoms, they might be similar to the normal side effects for that medication, but worsened. So for example, a seizure medication that normally causes just mild drowsiness might cause excessive sedation if extra doses are taken. So again, that just emphasizes why it is so important to know what those common side effects are and to really observe the resident to see what they are typically experiencing, so that you can notice if there are any changes that are not normal. There are some other general symptoms and indicators. I'm not going to go into a lot of detail on these, but there can be mental status changes, muscle symptoms, stomach symptoms, dizziness, falls, changes in vital signs, lots of different things that you could see. A lot of these effects can also be due to various medical causes that aren't medication errors. So a really good way to determine if it's a medication error is to just document. Like, you'll hear me say that again another couple times. Document. Carefully count and keep track of medications. Off pill counts can be a good way to indicate if there's been an error. So bottom line, document. By carefully documenting with lists and documenting dosages, start and stop dates, the log of doses given, that can go a really long way to make sure that medication errors don't happen in the first place. But then if they do happen, it can make it so much easier for healthcare providers, for the Poison Center, to determine what the ultimate risk is to the patient. So if you're ever in doubt, if you don't know what to do, if you have a question, you think something might have happened, just call the Poison Center. We are always open, always willing to help. Our staff, they're going to take a history, they're going to investigate by asking really detailed and targeted questions so they can really get to the bottom line of what has happened. Call 911 though if someone is having any trouble breathing or if they are unconscious. So this is our last section to go through. So as much as we would love for 100% of medication errors to be prevented, mistakes are still going to happen. So if an error does occur, we are here to help you. Call us right away anytime there is a wrong with medications, wrong person, wrong dose, wrong medicine, wrong time, wrong way, or anytime you are unsure if something has happened. One more time, this is our phone number. Hopefully you all have it memorized now. You've seen it a lot. It's been on pretty much every slide. So we are always open 24 hours a day, 7 days a week, every day of the year. Call us at 2 a.m., 2 p.m. We're going to be here ready to help, and we are always free. When you call, you can expect the following steps. So first, you're going to tell us what happened. It's okay if you're not sure about all of the details, but if you do know, you can say what was taken, how long ago it happened, how much was taken, how the person's feeling, and our staff will guide you through all of these questions. So once you have told them as much as you know, we're going to tell you what to do. So most of the time, we can take care of the poisoning over the phone. So we'll tell you exactly what to do and what to watch for. And it's great because you don't need to go anywhere. You don't need to take someone to the doctor. Don't need to go to the ER. You can stay home. And so far in 2020, we've actually kept 92% of folks home who called us first. This is especially nice during COVID because you're minimizing any exposure that you might have. Sometimes though, people do need to go to the emergency room. So we will tell you if you can, if you need to do that, if you need to call for an ambulance, what are the necessary steps that you need to take. And if necessary, we can even call the emergency room ahead of time to let you know that you're on your way and to suggest a treatment. Oftentimes, just like Alex said earlier, we're going to call you back just to make sure everything's going all right. You can ask more questions then, or you can always call us back at any time with any other questions. So just never question calling us. We love to help people. You're not going to waste our time. We're always here. So just call us right away. And there's that phone number one last time. So we have our final poll for today, which I'll have Alex launch now, which just is going to ask you how confident you are in knowing how to call us now. Give people a couple more seconds. All right, Alex, you can go ahead and close that. There's no need to share the results on that one. All right, so that brings us to the end of our presentation. Thank you all so much for joining today and for being so engaged in everything. If you have any questions, we're scheduled to be here until 4, so we'll hang out online and are happy to answer anything. You can also email me. My email address is up here on the slide with any questions or comments you have. Be on the lookout for the slides and the resources and the recording. I'll send that out in the next day or two, and the Adult Family Home Council will be sending out your certificates. So ask away with any questions. Otherwise, before you go, we do have a demographics questionnaire, which I'll have Alex launch now. This is just for our funders and our deliverables to them. If you're willing, we would love for you to fill it out for us. Just helps us a lot in the area. You can answer some questions, no questions at all, whatever you are comfortable with. So thank you all so much. Ask any questions you have. Otherwise, you can go ahead and sign off if you are done.
Thank you both so much. I really, really appreciate all your time that you've put in to provide these presentations for our members. I think that it's been especially just enlightening to repeat the presentations, the one on cannabis and then this medication management one. I think they've both been very, very helpful and well received. So thank you both.
Yeah, thank you for having us. We've loved presenting to your groups. You all are always very engaged, and Alex and I enjoy it when people actually engage with us in our presentations. Okay, so I'm seeing a couple questions here. So is it okay to destroy all meds if someone dies? I think that might be a Karen question as well.
Yeah, so in your medication disposal policy, you should indicate what your procedure is going to be if somebody moves away from the home or if they pass away. And so what are you going to do in those cases? And so, yes, it is appropriate to destroy medications, but it would be best practice to make sure that you have that in your policy.
Great, thank you. There's another question on how do you access / look up WAC information for medications. I can be sure that the link is included in the email that I send to you all with the slides, but I'm also assuming that the Adult Family Home Council probably has it posted somewhere on their website. And you can also just search for Adult Family Home WACs in Google, and it'll pop up on the Washington Legislative website.
Yeah, absolutely. The 388-76 section of WAC is all about adult family homes. And then the 388-112A is all about training for adult family homes. So if you guys need any assistance with WACs pertaining to adult family homes, definitely get in touch with us here at the council. And I can actually post my or a good general email for you to get in touch with us.
Perfect. Yeah, and Karen, you can just send it to Alex and I too. We can pop it into the chat box for everyone as well. Can a skin barrier be stored in the bedroom or bathroom? I'm personally not sure about that one. I'm hoping Karen can also answer that question.
So the question was, can a spin barrier?
Skin barrier, correct.
Oh, skin barrier. Oh, such as like a barrier cream. Got it. Yes. So if it is going to be used as a preventative measure, then yes, it can be stored in the bedroom. If it is going to be used as an actual treatment, then you're going to need to store it with other medications. And it would be good to have it stored away, especially if you have residents who are not safe around medications of any sort. You want to make sure that that you lock it away anyway, even if it is just a preventative measure. If they are safe being around a barrier cream, if they have use it on a regular basis, then you're going to want to put that in the negotiated care plan that they're safe around that medication, and then it can be used or stored more accessibly.
Perfect. Thanks. And everyone, I just put the email address, the general email address that Karen referenced in the chat box. And I'll put it in my email to you all as well. If some medications are discontinued, can you take these medications to take back places or follow medication disposal procedure, or do I still keep it? I'm going to imagine that would be in your medication disposal policy where you would outline all of that. But again, I'm going to lob that one to Karen if there are any specifics.
Yeah, so perfect. Yeah, so absolutely. If any discontinued medication, if you end up with any discontinued medication, you're going to want to follow your policy and dispose of those appropriately. You definitely do not want to keep any discontinued medication in your storage, your medication storage. It will actually lead to a citation if they don't follow the MAR, if they're not, listed on the MAR. So you want to follow that disposal policy.
Awesome. Who fills the med list, the pharmacist or the provider?
I'm assuming that they're talking about the MAR. And usually, if you're getting the medications from a pharmacist, and I recommend using a long-term care pharmacist because they will bubble pack things and it makes it much, much easier to manage everything. They will give you either an electronic MAR or a paper MAR to be able, that corresponds with the actual bubble packs, and it makes it much easier to just, keep everything in order. If you are using a different kind of pharmacy where everything comes in individual bottles, then you're going to want to create your own MAR. And so that's why we recommend using a long-term care pharmacy, because it can just help reduce the potential errors that can come from having so many different bottles and creating your own MAR as well.
Great. Well, folks, it is 4:01, so we want to be cognizant of everyone's time. Please email any questions that you might have, more about probably general medication management questions to me. For very specific things, adult family homes, I would recommend instead reaching out to the Adult Family Home Council, because I unfortunately don't know the nitty-gritty about all of the things you all need to do. So you'll get a much better answer from them. But thank you again for joining us today. We really appreciate you taking the time to listen in. And we hope you all have a great rest of your day.
Thank you.